Okay, so you've just had oral surgery. And if you're feeling a little overwhelmed right now, trust me, that is totally normal. But don't you worry, we are here to walk you through exactly what you need to do, step by step, to make sure you have a really smooth and speedy recovery.
All right, you're back home, that numbness is probably starting to wear off, and you're thinking, okay, now what? Well, this explainer is going to give you a super clear, step-by-step guide for what comes next, especially for these first few critical hours.
And just so you know, everything we're about to talk about, it comes straight from the standard post-op instructions that dental surgeons give out. We've just broken it all down into these clear visuals to help you follow along and, remember all the key stuff for a successful recovery.
Okay, first things first, let's tackle bleeding. Look, it's totally normal to have some bleeding after your procedure. Your main goal right now is just to get it under control so your body can really start that healing process.
All right, listen up, because this might be the single most important slide in this entire explainer. Your #1 job, your absolute top priority, is to protect the blood clot that's forming in that empty tooth socket. Think of this clot like a natural Band-Aid. It's protecting all the bone and nerves underneath, and it's basically the foundation for all the new tissue to grow. If you lose it, you're looking at a higher risk of pain and infection, so we gotta protect it.
So how do you actually do that? How do you protect it? Well, it's mostly about what not to do. So please, do not spit, and don't drink through a straw. Both of those things create this suction in your mouth that can just yank that crucial clot right out. Also, avoid rinsing your mouth really hard for the first 24 hours. Same reason. And last but not least, take it easy. No exercise for at least 3 days, because getting your blood pressure up can actually encourage more bleeding.
Okay, so what should you be doing? First, take a moist gauze pad and bite down on it with some firm, steady pressure. Now, if you run out of gauze or the bleeding just seems a little stubborn, a moist tea bag is an amazing trick. Seriously, the tannic acid in tea helps your blood vessels constrict and promotes clotting. And when you go to lie down, just prop your head up with an extra pillow. Keeping your head elevated really helps reduce the bleeding.
All right, once you've got the bleeding under control, let's move on to the next big thing, managing swelling and bruising. Swelling is just your body's natural response to what happened, and you should expect it to probably peak around 2 or 3 days after your surgery. So don't freak out if it gets a little worse before it gets better.
For the first 24 hours, ice is going to be your absolute best friend, but you have to use it the right way. Here's the magic formula. It's a super simple cycle. Apply an ice pack to the outside of your face for 10 minutes and then take it off for 10 minutes. Just keep repeating that cycle as much as you can. It helps constrict the blood vessels and makes a huge difference in reducing inflammation.
And this is a biggie. I mean it. Whatever you do not apply heat to the area. I know heat can feel soothing, but it does the exact opposite of ice. It actually increases blood flow to the area, which can make the swelling way, way worse. So for the first day or two, stick to cold packs. Only cold packs.
You might also start to notice some bruising pop up on your cheek. Don't be alarmed. It's completely normal for the skin to go a little black and blue, and then it'll fade to a sort of yellowish color over about a week. It's just part of the healing process. Nothing to worry about. Okay, let's dive into the topic that's probably on everyone's mind, pain management. Look, it's totally normal to feel some discomfort as that anesthesia starts to wear off. The real goal here is to stay ahead of the pain, not chase it.
So what you do really depends on how you're feeling. For a lot of people, regular over-the-counter pain relievers like Advil or Tylenol do the trick. But if your surgeon thought you might have more significant pain, they probably prescribed something a little stronger. The most important thing is to just follow the specific directions they gave you.
And speaking of those prescriptions, if you are taking them, you absolutely have to follow these safety rules. Never, ever increase the dosage on your own, and do not mix them with alcohol. These medications can also make you drowsy, so driving or operating any kind of machinery is a definite no-go. And finally, always take them with a little food or some milk to avoid getting nauseous.
So, what if the pain gets worse? This is a really common fear. You expect things to get a little better each day, but what if, a few days after surgery, it suddenly gets worse? Well, that could be a sign that something's up.
Right. A sudden spike in pain, especially around day 3 or 4, might mean you have something called a dry socket. And this is exactly what we were talking about earlier. It's what happens when that protective blood clot gets dislodged too soon and it leaves the bone and nerves exposed. If this happens to you, don't just try to tough it out. Call your surgeon's office right away.
Okay, we've covered the big, immediate stuff. Now let's shift gears and talk about 2 other cornerstones of a good recovery: what you're eating and how you're keeping your mouth clean. Both are super important for healing. First off, for the first couple of hours, just give your mouth a total break. No food at all. After that, you'll want to stick to a soft diet for a few days. So think yogurt, mashed potatoes, maybe some smoothies, but remember, no straws. You'll also want to avoid alcohol and anything that's super hot or super cold. Staying hydrated with lots of liquids is key. And hey, taking some extra vitamin B and C can give your body the building blocks it needs to heal up a little faster.
Now, keeping the area clean is absolutely vital to prevent infection. But remember our rule about not rinsing for the first 24 hours? Okay, so after that time has passed, you can start rinsing very, very gently with some warm salt water after every meal. Just mix about a teaspoon of salt in a glass of warm water, swish it around gently, and then just let the water fall out of your mouth into the sink. Don't spit.
And this one is so important. You have to avoid smoking for at least 24 hours after surgery, though honestly, the longer the better. The actual act of inhaling can dislodge that blood clot, and all the chemicals in smoke can seriously get in the way of your mouth's ability to heal. It just skyrockets your risk of infection and, you guessed it, a dry socket.
All right, we're almost there. Finally, let's talk about what to expect in the later stages of recovery, just so you know what's normal as you're healing up.
Okay, this might sound a little weird, but it's a totally normal part of the process. You might feel these little sharp bone fragments starting to work their way out through your gums. Your first thought might be, oh no, it's a piece of the tooth. But rest assured, these aren't roots. They're just tiny bone slivers, and they will almost always come out on their own without any issues.
So, if we boil everything we've just talked about down to its essence, it really just comes down to these 3 golden rules. Number 1, protect that blood clot at all costs. Number 2, keep the area clean with gentle rinses and stick to a soft diet. And number 3, listen to your body. If the pain gets worse instead of better, don't hesitate. Make that call to your surgeon.
And that's really it. You know, recovering from oral surgery is a process, but if you just follow these simple, clear steps, you are putting yourself on the fastest possible track to feeling better. You've totally got this, and we wish you a comfortable and happy healing.